All right, good afternoon, everybody. We are back with another Wellness Wisdom Talk. And today's topic, we are going to be talking about everything hopefully you ever wanted to know about food sensitivities, including current options for testing and treatment. So how we've sort of structured the talk is we're going to talk to you about the differences between food intolerances, food sensitivities, and food allergies, and then how those symptoms, how they can produce symptoms that affect you. And we're going to talk about the type of testing that's available. We're going to talk about insurance coverage for that testing. We're going to give you the pros and cons. And if we have time, we're going to do a demonstration at the end. Okay, so we're going to start by, I'm going to introduce, for anyone who doesn't know me, I'm Angela King, owner and clinic director at Indian Acupuncture and Functional Medicine for the past 14 years, and Chelsey Dodd has been with us about 8 years, and so I'll let her introduce herself and tell her story, because her story with food sensitivities and her personal experience really does, we see it a lot of times, similar things in the clinic, and she's got a really amazing story, so I'll let her share that now.
Hi everyone, I've grown up around functional medicine and holistic medicine, and my mom was into it in the 80s, long before it was ever popular. So my understanding of food allergies has been around since childhood. And then I went to acupuncture school, and then I went to get a master's in nutrition, so a good base of a knowledge there. But I was still surprised when they happened to me in a way that I wasn't expecting. So around my 20s, I suspected an issue with gluten sensitivities, and it caused a lot of symptoms, and I pretty much completely cut it out and felt like I had a handle on my food allergies. And then fast forward to about 7 years ago, I started taking a food-based multiple vitamin, and I was really excited about the fact that they sourced from food. It was all natural, really great ingredients that have great properties, and I took it for about a month, not making the connection then. A month later, I started having some pretty heavy GI symptoms, constipation, diarrhea, alternating headaches, brain fog, just not feeling good, not making the connection. Then I started to have some GI bleeding and really became concerned and reached out to begin the process of doing a colonoscopy. But in the meantime, in our office, we had been doing a cytotoxic food allergy test called ALCAT, and I had done it on quite a few patients, so I decided I would see if there was anything lurking besides the gluten. And to my surprise, although gluten was a moderate reaction, parsley, green tea, black tea, spinach, and a few others that were surprisingly big components of my food-based food vitamin showed as severe reactions. So obviously I discontinued that vitamin right away, cut those items out of my diet, and the symptoms were gone in about 4 or 5 days. The bleeding stopped, the diarrhea stopped, all of those things. And I will mention that when I ate a spinach salad for lunch or drank black tea, I didn't notice anything severe and by any means even 24 hours later immediate with any sort of consistency. So it was a total surprise to me, and it opened my eyes to how these things can affect us without us having any idea, even when we don't make the connection. So we've used it successfully with a lot of our patients, from everything for helping with weight loss to headaches to other things that are not necessarily the GI spectrum. So we wanted to talk to you today about how they can affect you, how we can figure out what they are, what's the best way to go down that road.
Right, and already a little clinical pearl there that Chelsey mentioned is so often, I think, when patients are, maybe at their health food store or shopping online for a product like a multivitamin or even a greens drink, right? Because those are very popular, have been popular. What's interesting is they seem great because they're whole foods and they're advertised as organic, and you'll read the label and it'll say, it'll have your vitamins A through D, whatever else, and minerals, and then it'll have a little section that'll be like organic blueberry and pomegranate and broccoli and kale and all these superfoods, right? But the problem with that is exactly what Chelsey just said. If you're sensitive to that particular food, it can really cause a lot of distress, and ultimately you're hurting your body rather than helping it.
So and if you have the tendency towards food allergies, taking a concentrated dose of things on a daily basis for an extended period of time can be can be a problem.
Right. So we're going to start by telling you about the differences between a food intolerance, a food allergy, and a food sensitivity. And we're going to jump like food intolerance first. So this is really something that does not involve the immune system at all. Okay, so a food intolerance is when your body actually lacks a specific enzyme to break down a certain food. So most people are very familiar with lactose, or have heard the term lactose intolerance, right? So these people who have lactose intolerance, they are not allergic to dairy or milk. Okay, they lack a specific enzyme, lactase, that helps break down lactose, which is the milk sugar in milk. And so now when they eat dairy, they experience like the GI cramping, bloating, diarrhea, that sort of thing very commonly. But it's not because they're allergic to the food or even sensitive to the food. It's because they're intolerant and are missing the enzyme. Another common food intolerance that people are learning more about these days is called histamine intolerance. So this is where people have reactions when they eat certain foods, or like alcohol, aged cheeses, like say Parmesan or Asiago or something like that, smoked meats, bacon could be in that category, pickled foods like pickles or sauerkraut, shellfish, certain legumes, beans, nuts, chocolate, and eggplant, just a select few of the foods that are naturally high in histamine. So what happens is when people eat these that are histamine intolerant, they're lacking a specific enzyme called DAO, which is diamine oxidase. And so they can't break that. They can't degrade the histamine like they're supposed to. And so then they'll get more of a release of histamine in their body, which histamine is the chemical that's stored in your mast cells and released from your mast cells, and is responsible for inflammation in the way of swelling, itching, that sort of those reactions, symptoms that you would think in your experience to take an antihistamine for, right? So certain foods can trigger that when you have a histamine intolerance. So food allergies are at the other end of the spectrum, okay? So food allergies true food allergies really occur in only about 5% of the population. And these are mediated by your immune system. So you're having an immune reaction to a specific food, and you're producing what's called IgE, or immunoglobulin E. That is a very specific immunoglobulin for allergic reactions. These typical food allergies typically the food allergies will cause a reaction either immediately or at least within the first couple of hours after consuming that food. Typical symptoms you might think of here would be rashes, hives, itching, swelling, and all the way to the top end of the spectrum of food allergies, which would be anaphylaxis. The peanut allergy type comes to mind, or the shellfish allergy. Those are some of the more common food allergies that can progress all the way up to anaphylaxis. So it causes this flood of histamine in the body, mostly affects the airway and the GI tract. And these reactions can actually get worse over time. So say you eat that peanut the first time and you don't really have a reaction, you have a mild reaction, you eat it again, this is called sensitizing, you can get a stronger reaction and a stronger reaction all the way up to anaphylaxis. So these can be dangerous, but they can also they're tested most commonly through two pathways. So you can measure IgE, immunoglobulin, circulating levels of IgE in the blood, or you can do these patch tests that typically you would go to your allergist to do, and that would be when you have they do the little skin prick and they're looking to see if you form a hive or a wheal, because that is what a histamine reaction looks like, right? The problem is, since less than 5% of food issues are allergies, this type of testing does miss a lot of what we classify and science classifies into the category of food sensitivities. So I'm going to turn it over to Chelsey and let her start explaining to you where most people find themselves with significant food sensitivities that can cause a variety of symptoms.
Okay, so food sensitivities are much more common. 20 to 30% of the population likely suffers from them, and they occur much later on than a food allergy would. So food allergy, immediate. Food sensitivity could be 2 hours later, could be 2 to 3 days later. So you often can't tie things exactly because you could be reacting 72 hours later to something you've eaten and you're not even quite sure you remember what you ate back then. These are also mediated through the immune system, so it is an immune reaction, very different type of immune reaction than the IgE reaction. So, do we need to stop for technical difficulties?
Hold on one second, guys.
Okay.
So, let's try this. And, can somebody on the Indian River Acupuncture Facebook page let us know if the sound is fading in and out still? Because I'm having a feeling that it might possibly be something with my phone. And even though we were using the microphone, it may still be happening. If it's happening still on Indian River Acupuncture, Lisa's gonna type in, and if you guys can jump over to either like my personal page, because we're live off that too, which is Angela King, and it's public, so you should be able to find it. If you can, thanks Brandon. So if you guys that are on the Indian River Acupuncture page, if you can go over, just search Angela King and jump on over to the Angela King personal page, then that should solve the problem. Or we can put the Zoom link in the comments there, and you're more than welcome to jump on Zoom if you can't hear us on one of the Facebook Lives. We can definitely get you, we can put that link right in Zoom, or just hop over to Angela King. So ANGELAKING, Lisa, if you can maybe put that in there. And I would love for you guys to hop over to Angela King so you can hear us, because I'm getting a couple people there saying that the sound is fine. Sorry about that, Latrice. I know, I don't know. We got a mic, and I have a feeling it's more, maybe it looked like an issue with my iPhone. But we're gonna put that Zoom link in, and we're also live off Angela King, and you guys can hear over there, which would be awesome if you could switch over. Sorry about that. Okay.
Should we give them a second? Or?
Yeah, so we're gonna just get back to food sensitivities, and
should I start over?
Yeah, we'll just introduce that again, just so anybody who couldn't hear is up to speed on the basics of food sensitivities.
Okay, so to repeat, food sensitivities much more common than true food allergies. 20 to 30% of the population is suspected to suffer with these. They are a delayed reaction. So instead of 2 minutes to 2 hours, it's 2 hours to 2 or 3 days. So you could be reacting to something as much as 72 hours after you've eaten it, and you've probably forgotten what it was you even ate 72 hours ago, or you've been eating it ever since. So they're very hard to detect that way. Okay. So they are also mediated through the immune system, though in a very different way than the IgE.
Allergies, and then how those. Hold on.
Sorry, guys.
Okay, we're good. That was a little weird issue there. Okay.
Testing the technical gods.
Yes.
Okay, so different than the IgE-related food allergy, this can be mediated through a variety of different types of your immune system that create inflammation. So the inflammatory chemicals are released either by different immunoglobulins or by your cell-specific lymphocytes, granulocytes. The inflammatory chemicals are released and they float through your bloodstream and lodge in a variety of different organs or tissues, skin, joints. You can have issues with even the brain and thinking, definitely GI, definitely respiratory. We'll get into all of that later, but this can affect your whole body in one way or another. And generally people eat things they're allergic to every day, so you eat them daily, they build upon each other, build upon each other, build upon each other, and reactions occur in small steps, building and building, and then becoming a chronic condition.
And I would say, like, to sensitivities, but right, like with food allergies, it's really like that really strong inflammatory response, like right off the bat, very quickly. So if you think of fire, right, this would, like an IgE mediated food allergy would be like a fire, okay? And then these food sensitivities that are different immunoglobulin mediated or white blood cell mediated, like she said, with the lymphocytes and granulocytes, those are more like smoldering ash, right? So you don't necessarily, it's hard to pinpoint. You can't really necessarily point to exactly what food's causing it, because if you're eating it all the time and it's sort of low-grade inflammation, that's like that, you're just kind of feeding that smoldering ash and you're never really putting the fire out, right? So go ahead and talk about the different types of food sensitivity reactions. So now we're leaving intolerance, we're leaving allergies, and we're just going to hone in on food sensitivities, because this is what is so much more common to the general population, right? And so there's actually 2 different types or pathways for food sensitivities, and we just want to make sure that we explain that, because that's going to make a difference when it comes to the test that we choose.
So there's 2 types of reactions. They call them type 3 reactions and type 4 reactions. So type 3 reactions are your immunoglobulins. Your body is making antibodies against these food antigens and creating an inflammatory response as a result. These are measured by measuring the variety of different immunoglobulins in the blood. So test IgE, or IgE, IgA, and IgG. IgE is more related to the food allergies. And so those would be the type 3 reactions. Type 4 is the cell-mediated reaction. So the best way they have currently to test those is a volume change in blood. So they'll culture your lymphocytes and other immune cells, and they'll measure the volume of solid to liquid prior to the exposure to the food antigen, and then after. And the theory is the more immune cells that release inflammatory mediators is going to change the volume of the blood. Those cells are going to shrink down in size because they've released all their chemicals. So we don't know necessarily with the technology we have now which cells are active. We just know how much inflammatory mediators have been released.
Yes. So with that, we want to move into the symptoms of food sensitivity. So I think the most important thing to understand is that this transcends GI symptoms, right? So a lot of people, it may be more obvious if they have bloating. They may not be able to pinpoint the food specifically, but they know when they have bloating, or they have gas, or they have diarrhea, they're like, okay, it may be something I ate. But there's lots of other systems in the body that food sensitivities can affect. So we're going to just give you some of the key symptoms that are related to food sensitivities by organ system in the body. So of course, like we mentioned with the GI, you've got your bloating, your diarrhea, constipation, irritable bowel syndrome, definitely correlated with a lot of food sensitivities, acid reflux for sure, gastritis, even colitis. And a lot of people also get post-meal fatigue, so they may get really tired after they eat. And that, of course, could be from high carb load, but it could also be from food sensitivities to something that you ate. The other thing it can cause is a lot of food cravings. So it's very common to crave the food that you're most sensitive to. And so people that have cravings for sugar or carbs, or they like potato chips or things like that, they could very well be sensitive to that particular food.
The next thing we're going to talk about is respiratory symptoms, the most common being sinus congestion, lots of mucus production following the meal or slightly later, sinusitis, chronic cough, productive or dry, allergic rhinitis, and a variety, even asthma, can be related or aggravated by food sensitivities.
For sure, like that sinus congestion that just doesn't seem to go away, or that runny nose. Sometimes people even get a runny nose like while they're eating or after they're eating, and that can definitely be a sign of food sensitivities. Also, do you want to talk about dermatologic conditions? I know you were doing that earlier.
You want me to do angry?
Yeah.
Okay.
Yeah.
So dermatological is another one that not everyone recognizes the connection, but actually we've seen a huge connection between food sensitivities and things like eczema and psoriasis, atopic dermatitis, those kind of itchy inflammatory skin conditions where those inflammatory mediators can lodge in the skin easily and create a lot of inflammation there. Bumps on the skin, dark circles under the eyes, and one of the things you may have noticed if you have kids is there's an association when you go to change a diaper that children will actually get a reddish purple ring around their bum when they've eaten something that they're allergic to, like all those mucosal tissues becoming so inflamed. So if you see that after your child's eaten, you should suspect there could be something going on there. You don't know if it's the meal they just ate or the meal they ate 2 days ago, but you know there may be an issue.
Something going on, right? Yeah. And so there's also neurologic issues that can occur because of ingested foods that you're sensitive to. So migraines and headaches is a big one for a lot of people, can be directly related to food sensitivities. In kids, we often see behavioral issues and hyperactivity. I mean, everyone thinks of that with sugar, but sugar is not the only culprit, right? So there's many other things that can cause this sort of hyperactivity after eating. Sometimes we see like foggy brain fog after eating certain foods, mood changes in adults as well as kids, like anxiety, depressed mood can also be related to food, certain sleep issues, and then of course the extreme of that would be seizures, but certainly seizures can result from eating foods that you're allergic or sensitive to.
And also musculoskeletal issues. So we see a lot of arthritis in the clinic, and we find arthritis is usually either structural, so something's out of line, or major overuse or trauma, or it's metabolic inflammation. So if there's degeneration in many joints in absence of major trauma, we suspect that that might be metabolic inflammation. These inflammatory mediators can lodge in the joints, muscles as well. So it can cause a lot of pain, stiff muscles, tense muscles, pain in the joints, that type of thing.
And also food sensitivities can wreak some havoc in the endocrine system. So one of the things that we hear a lot is people who have difficulty losing weight. And one of the triggers for, or contributing factors for difficulty losing weight can be food sensitivities. So as we kind of hit back again on the fact that food sensitivities cause inflammation, right? We know, like medical science knows now, that obesity is an inflammatory disease. So anything that exacerbates inflammation in the body, like food sensitivities, can absolutely inhibit someone's ability to maintain a healthy weight or be able to take off those, 10 or 15 or 20 pounds that they've been wanting to, but they're eating things that are inflaming their body even when they're so-called healthy foods on their whole food diet. If they're reactive to it, it doesn't matter if it's healthy or clean or not, right? It's still inflammatory. So also thyroid issues, especially autoimmune thyroid issues like Hashimoto's, right? These are often, there's a whole nother talk that we could do on why autoimmune diseases have a link to food sensitivities, but for sure it does. I'll talk a little bit about it when I'll mention it when we talk about leaky gut in a minute, but for sure thyroid issues, infertility can be due to food sensitivities. Anything that's causing inflammation and causing your immune system to overreact can now affect other areas of your body for sure. Menstrual issues, all of that type of thing.
They play into like the how easy or how horrible menopause can be.
Can be, yeah, for sure.
And then finally, allergies. So food sensitivities, which could be the chicken or the egg with immune issues. You're constantly having a challenged immune system. It's constantly addressing these things on top of what it normally has to do. And generally, over time, that can result in an immune system going haywire and beginning to now attack your own tissues as well as the food antigen. So that's where autoimmune connection comes in. Or suppressed immunity, because it's just exhausted from this constant inflammatory response, this constant response to the food you're eating every day. So it's a major challenge to the immune system. And another sort of interesting clinical thing I've heard through the years from doctors I've done internships with is that if you notice a significant change in your pulse after you eat, and this is not so much relevant for the super delayed onset, but some people notice after they eat that their pulse goes up 20 or 30 beats a minute, that's a sign that the body is either in a true food allergy or sensitivity. There's a reaction that's starting to happen. So 10 beats per minute is normal digestion type thing, but if it's more than that consistently, that's a little bit of a clue or a sign.
Right, and now, people have their smartphones and their watches and things like that, so it's much easier to track your heart rate than ever before, right? Yeah. So that's something, a simple way that you could maybe explore at home and just start paying attention a little bit more to what happens after you eat. So these symptoms, and now whether it's food allergies or food sensitivities, but these type of symptoms can develop at any time in life. You could have eaten something your whole life and then suddenly start having more of a reaction to it. So why is that really? Well, lots of times food sensitivities do start to show up or arise during periods of high stress. So stress, and that's what you perceive as high stress, right? So that stress is different from person to person. It doesn't matter what the event is. It's about your perception of the event and how you respond to that event. So if it's a stressful period in your life, no matter what the cause, stress disrupts the gut microbiome, and that can lead to the development of specific food sensitivities that you didn't have before. Additionally, we often see food sensitivities come about when in developmental periods of the life, right? So when a child is growing up, maybe hitting a growth spurt, or when a child is going through puberty or adolescence to adulthood, right? There's an influx of hormones and chemicals and everything going on at that time, and that's also very common time for food sensitivities to kind of get mixed up in that as well. We see, like, I've seen a lot of kids in that sort of puberty to adolescent age with acne, bad acne on their face, and it really affects their self-esteem a lot of times, right? And they're teenagers, and they come in and we do food sensitivity testing, they change their diet, and the acne clears up. So yes, acne can absolutely have a hormonal component, but it can be exacerbated by foods that have become reactive during this transitional time in life. If we don't have that proper diagnosis, then like we said before, you're just kind of eating those foods over and over again without really understanding what it's doing to your body, and causing that low-grade inflammation all the time. And it just sets the stage for an environment in your internal milieu that becomes ripe for chronic disease to have a foothold, or weight gain to start developing. So we want to look at the reasons, other reasons why food sensitivities may develop. So Chelsea's going to talk about that.
So there's quite a few things. I'll touch on some of the most common. Susceptibility is dependent on, one is genetics. We definitely see trends in families. So if many people in your family have issues with symptoms related to food, there's more of a likelihood that you will. So my mom did, I do, I suspect my daughter does. So they tend to trend in families, but not always. One of the big ones that Angela's going to talk about in more detail is the permeability of your colon. So if there's little tears in your colon, bigger food particles get out than they should, and this triggers an immune response. So she'll tell you more about that. How well your liver deals with toxins, hormones, chemicals, those types of things. So is phase 1 and phase 2 harmonious and working really well, or is your liver overwhelmed and backlogged and barely being able to keep up as it is? That's going to make things worse in the food sensitivity world too. And then some other things that we probably won't get to in detail in this talk: how foods interact with each other, cross-reactivity between foods, how much you eat, when you're eating, those types of things can definitely affect how the food allergies develop. And stress, for sure. Stress, we know, causes an increase in the hormone cortisol. Cortisol, we know, suppresses IgA. If you listen to any of our other talks, we've harped on IgA being your first line of defense. It's like the mucosal barrier army that keeps things away in a relatively non-inflammatory way. So if IgA is suppressed, then the other parts of the immune system have to get involved to make up for the lack of IgA, and these are more inflammatory responses. So yes, this creates more inflammation that's happening if IgA is not able to do its job. And then Angela's going to tell you more about leaky gut.
So leaky gut is the colloquial term, I guess you could say, and maybe you guys have heard of that terminology before, but really the medical term is intestinal permeability. So what does that mean, and what does it have to do with food sensitivities? Okay, so your colon, your intestine has these structures called tight junctions, and tight junctions are woven, cells that are woven very tightly together. And that's because the intestine's job is to regulate trafficking of antigens, which are certain proteins across that gut barrier, across the mucosal barrier, right? So what happens is when these tight junctions become irritated or inflamed and become loose, now what happens is you have molecules, undigested, partially digested molecules of food leaking out through the intestine into the bloodstream, and that can create a situation where something called molecular mimicry happens. Molecular mimicry is really, really interesting. There's a lot of research in this area that to me is fascinating to read, because molecular mimicry, what that means is that the peptide sequences of specific foods, such as milk, wheat, corn, tomatoes, even spinach, that peptide sequence is similar enough to human molecules that the immune system doesn't recognize the difference between the human molecules and the food molecules. So it mimics, right, these food molecules mimic other human molecules, and the immune system can get confused and start to mount an immune response that it shouldn't, right?
Even against your own tissues.
Even against your own tissues. And that's the basis of, really one of the bases for autoimmune disease. So there's some really interesting look at something called aquaporins, which we're going to come back to in another talk because it's just a fascinating topic. But it's when the amino acid sequence of these certain foods, they look similar to even oligodendrocytes in the brain, and how that can be attacked and sets the stage for neurological issues, sometimes even MS, things like that. It's really a fascinating field of research. But to kind of bring it to the take-home point, right, is that we want to understand that these intestinal tight junctions, when they become loose, and there's a protein called zonulin that when it increases, it can irritate the lining of the tight junctions. So think of that lining like a barrier, just like your skin is a barrier, right? If I was constantly scraping my skin every day, right, I'm going to have inflammation. It's not going to heal. Things are going to get in, right? Bacteria are going to be able to get into my skin that weren't able to get there before. It's no different with the mucosal lining of the gut. So we want to regulate those tight junctions, but food sensitivities can definitely cause the irritation there in the lining of the gut, and over time, now we end up with leaky gut, and we end up with problems because of that. So.
Okay, so now that we know how important this is, how do we figure out what they are? We just got finished telling you how hard it is to figure out these delayed reactions. So we have some tools, and I want to start with the oldest and what is still considered the gold standard, and this is called the Elimination Diet. And in order for this to truly work, it's quite a strenuous process, and I remember my mom did this maybe 20 years ago, a long time ago, but I remember the process. She was admitted to a hospital in Chicago. They water fasted her for 10 days. Because the thought process is you have to get the immune system, everything calm, everything at baseline. And so they supervise that, and there's many varieties of this protocol now that aren't quite that extreme, but the more extreme, the more accurate. And then they will introduce the first least likely reactive food. So it used to be rice. I think they've changed it. There's a protocol, a step of foods that you add back one food at a time. That one food is consumed for 5 days, and then any symptoms are noted. So if there's any symptoms outside the norm of baseline, it's documented, and the process has to start over again. So if you had gotten 3 or 4 foods with no symptoms, and then the 5th food produced a symptom, you would have to start back over with only the foods that you knew didn't cause symptoms. So as you can see, it's a almost insurmountable task to do if you have a family or work or a life to keep a hold of. So there are minimal interpretations of this diet. So I don't know if anyone has heard of the Autoimmune Diet. So that's an anti-inflammatory diet that you eat for 30 days, and then you start introducing foods in a similar manner. But if you're like me, that would have failed completely because parsley and teas and those types of things are considered anti-inflammatory. Right. And what we've seen in the clinic, I don't know about your patients, but my patients are often sensitive to at least one, quote, clean food.
Oh, for sure. Yeah.
So
absolutely.
that, I think, has its issues doing it the more simplified way. So so that's the gold standard, and a lot of these tests are compared to that when they're assessing their accuracy. So we're going to talk about the imperfect tests that we use in our office. They're all imperfect. They have strengths and weaknesses, but we find them to be very helpful in navigating this road to figuring out what's going on. So Angela's going to start talking about Dunwoody.
Okay, so one of the ways, so like we said before, how we were telling you that there's two different types of food sensitivities, the type 3 reactions and the type 4 reactions, okay? So Dunwoody Labs, they're based out of Dunwoody, Georgia, and we've been utilizing them for a few years now. And we're going to give you like the pros and cons on this particular test, right, and why we use it. So this measures the type 3 reactions. So the type 3 reactions, remember, are the ones that are immune mediated, but they are immunoglobulin mediated. So they can be IgE, IgG, that sort of thing. Okay. So this particular test with Dunwoody measures 88 foods, and it measures that across 4 different immune pathways. Okay. So this test does do both allergies and sensitivities. So it's looking at IgE, and then what's interesting about this test is that, remember how we said that only about 5% of the population has true IgE mediated allergies, and certainly, you know, anaphylaxis is not a common everyday event for people. What they found is if we just measure IgE alone, we could be missing something. So they have measured this in conjunction with a compound called IgG4. So what this means is that they're looking for food allergies, okay, but they're quantifying your IgE level. So remember, this is done through blood. If I didn't say that, it's done through a blood draw. And they're quantifying your IgE, circulating IgE or immunoglobulin E levels to particular foods. So they're also measuring your IgG4 reaction to those same foods. And why is that important? Because if you have a release of IgG4 in response to a certain food that you also have an IgE response to, but the IgG4 response is greater, then that offers immune tolerance, okay, so that it decreases the reactivity of the IgE response. So you likely won't feel that allergy reaction happening because you've gotten protection from immunoglobulin 4, or IgG4. So we're looking at this very specifically to really hone in on what's creating an allergic reaction and what is offering protection from that allergic reaction, so that food is basically safe to eat because your immune system is working hard to make it that way. The IgG4 compound blocks the IgE from being able to bind to the receptor, so it can't bind and it can't release its histamine. Okay, so that's one thing that it tests. And then it also tests IgG, but IgG response in conjunction with complement protein. Okay, why is that important, and what is complement protein? Okay, so IgG alone has really struggled to find any real clinical significance to high levels of IgG alone to a certain food. So just because your IgG level is elevated does not mean necessarily that you're having inflammatory reaction. Certain people just seem to release a lot of IgG when they eat foods. So a lot of these, we're going to look at the problems with some other tests, but sort of IgG alone just isn't enough, okay? So to tell you if it's really causing inflammation. But they measure this other compound called, or protein called complement protein, C3D, okay? It's a specific complement protein that when it is activated along with IgG, it increases the inflammatory potential. The reaction of that inflammation is increased from anywhere from 1,000 to 10,000 fold when complement protein is activated in response to eating that particular food, right? So now you really know, okay, well, I have a high IgG response to that food. Does it mean anything? Well, if complement protein is activated at the same time, then yes, it means a lot. It means that there's a lot of inflammation going on when you eat that food. Complement protein is part of our innate immune system. So again, back to our immune resilience talk we did before, that innate immune system is the first line of defense. And complement gets activated as an inflammatory response, which can be protective in certain immune situations, but not in this one, right? So it's increasing the inflammatory potential of foods significantly. So Dunwoody has been able to show 95% reproducible results, 94 to 95% depending on, that means the same blood being retested, getting the same response on the same day, right? The same results on the same day. That was 95%. Then I believe it was like 5 days later they retested it and 94% accuracy. So this test does have a lot of reproducibility, which is important in science. Okay, so that's good. And the criticism I would say of this test is that it doesn't catch all of those type 4 reactions. So it's really looking at the immunoglobulin reactions, the IgE, the IgG4, complement protein, and IgG, but it's missing the piece for the type 4 reactions. So we're going to come back to this test in a minute when we talk about some of the other benefits when it comes to insurance coverage and that sort of thing. But it's a very good test, and we have seen a lot of Dunwoody. Yes, sorry, I see a question. It's called the Dietary Antigen test. So it's Dunwoody Labs is the name of the lab in Dunwoody, Georgia. But it's called the Dietary Antigen test. And so Chelsea's going to talk about another test, and then we're going to come back to costing of these tests and insurance coverage.
So the other one that we have begun to use in the office that is sort of an improved technology from ALCAT, which we did, probably a lot of our patients that have on here have had ALCAT. We use that a lot. This is a cytotoxic food allergy test. So it's measuring inflammatory markers, the cytokines, prostaglandins, those types of chemicals that are circulating as a result of food sensitivities. So this is also a blood test. They take your blood test, they culture the white blood cells, and like I had mentioned before, they measure the volume before and after exposure to a food antigen. One of the things to be aware of that both Dunwoody and MRT use freeze-dried food antigens, which are important so that they're not sort of contaminated with other things that could produce a reaction and give you a false positive. So these measure type 3 and type 4 reactions, not food allergies. IgE is not measured at all. So you would get no food allergy information from this test. And you would get no specific, you wouldn't know which immune cell was doing what it was doing. You would just know that there was inflammation happening. So they do test 170 foods, which is more foods, which is good. And they also test common chemicals that we see issues with in the clinic a lot, like caffeine, sulfites especially, certain amino acids and preservatives, MSG, those kinds of things are tested. So it gives you an idea, because sometimes chemicals can produce symptoms and not necessarily the food antigen, so it helps you get a little bit more specificity in what to avoid. The criticism of this test is that the reproducibility studies they have are small, and they were done in the late 90s, so we don't have anything recent or peer-reviewed or really large to prove the accuracy. So that's definitely a criticism of this type of test. But the studies we do have are studies using the Leaky diet, which is the diet that was derived from the MRT test, shows clinical and significant reduction in some of the symptomology that's most associated and most researched with food sensitivity. So irritable bowel syndrome and migraines have some strong studies showing that participants that follow these Leaky diets, so removing their sensitive foods, have really good reduction in those symptoms. And did I have anything else? Oh, clinically, with ALCAT even, we've seen great results in headaches, in weight loss, in acne, depression and anxiety, and many different things. So it's been very clinically positive for us we've been doing those for 5 or 6 years.
Yeah, a long time.
Yeah.
Oh yeah, longer than that. I think 2013.
Okay.
Yeah.
Yep. So then really quickly, I also wanted to mention, I don't know if any of y'all have seen on Facebook or Google or TV even, these advertisements for the food allergies that you can mail off.
Food sensitivity.
Food sensitivity,
yeah.
Excuse me. So those tests are generally IgG only. So as Angela was saying, IgG tests are very reproducible, but not so often clinically relevant, because some people will show high levels of IgG to a food but have no clinical symptoms or no inflammation related to it. So even if it's reproducible, if it doesn't necessarily mean anything clinically or inflammation-wise, it's not necessarily great information. So some people that do it get great results from it, and those may be the people where IgG matched complement and we just don't know it, or the people that it doesn't, maybe those where that wasn't lined up. So we're missing a lot of pieces of the puzzle with those tests. And those, the common ones are Everlywell, Genova, Pinner test, and I'm sure there's quite a few others that you could get. So just, if you're paying for that, they tend to be cheaper, but a lot of times you're getting less useful information.
Right.
So you're kind of still stabbing in the dark a little bit.
Right, for sure.
And then now we have the gene-based diets based on 23andMe information, and they, based on your gene mapping, give you an idea of what types of foods you may or may not be sensitive to, like alcohol or high carbohydrate diet or high protein diet or those types of things for weight loss. And I kind of liken these tests to like the food allergy or the food type diet, that they work for some people. It's a very broad category and it doesn't account for all the individuality that could be buried underneath there. So if you really suspect symptoms based on foods that you're eating, it probably is not the best place to spend your money, although it could be interesting to see, to tie it to your 23andMe. But if you're choosing that over one of the others, I think you'd be better off with one with better science behind it.
For sure. So in terms of testing here at our office and what sort of we take into consideration, why when we recommend one of these tests over the others, it's like, what is the patient trying to accomplish by the test, right? Are they more interested in weight loss? Are they inflamed? Do they have joint pain? Do they have migraines that no one can figure out why? You know, do they have infertility? Do they have autoimmune, Hashimoto's, right? Like, what is their end goal for trying to find out about their food sensitivities? So we take that into account. We also take into account their resources and the cost of these tests, because that matters, right? And we'd rather have some guideline than no guideline. So with Dunwoody, that test, the wonderful thing about that test is it is covered 100% by Medicare. So there's no reason for anyone, you know, who's interested, who has Medicare, not to do that test, because and that just started actually in December of 2019. It didn't used to be covered, but it recently became covered by Medicare. They also do insurance billing. So the most that test would cost someone with insurance is $299. You're required to make a $49 copay, and then they bill the insurance, and then if depending on what the insurance pays, you may not have to pay anything else, or it would be up to a total of $299, including your $49 copay. Okay. And then the out-of-pocket cost for that test, if you have no insurance at all, is $379. Now with MRT, the one drawback on this test is it is not covered at all by insurance. No insurances cover it. No, doesn't matter who orders it, it's not covered. So that out-of-pocket cost is $435. Now, like Chelsey mentioned, you are getting more tested there, like you mentioned with some of the food additives, sulfites, you know, things like that. You are getting a broader scope of foods tested for the little extra money that particular test costs. So now what do we do? Let's talk about, and if you are interested in food sensitivity testing, what you would do for here is to call the office, especially during this time of still COVID and telehealth and all that. This is not something that you need to come into the office for. We can do this over telehealth. We can assess what your needs are and then order the proper test for you. So we can do it that way as well. So what do we do with the results? So here's how we treat food sensitivities. Let's look at the steps that we do to heal our gut when it comes to foods and what that looks like. So now you've done the test, right? And now here's your results. Okay, how do we interpret that and what do we do?
Okay, so depending on which test you chose, it's kind of like a puzzle. I would say Dunwoody's like a puzzle. You put all the pieces together and you see how extreme are these reactions, how many are there, and the same with the MRT test. And we look at how severe are the symptoms, how severe do we think the inflammation is, how many foods are you reactive to, because I've seen most patients maybe around 20 foods, but I've seen patients with reactive to at least half or even more. So we have to make it doable.
Right, and we want to say like the test is going to grade, if you will, your food sensitivity reaction. It's going to give you a list of foods that after that 72-hour period of time, they do test it over, if we didn't say that before, they do test it over a period of time. So if over that period of time you had, no reaction to the food. You'll get a list that's like, these foods are 100% safe for you. You had no reaction. Then you're going to get a list that says mild reactivity, another list that says moderate reactivity, and then another list that says severe or high reactivity.
So we prioritize the moderate and severe if there's enough of those. If someone only has mild or a handful of moderate and some mild, we would actually try to eliminate the mild. One of the other limitations of MRT that I didn't mention is within mild, there's sort of a wide window. So some mild reactions could be more significant than others. But we have to look at what we have. So either mild, moderate, or severe will be limited or completely restricted for a period of usually 2 to 6 months, depending on your life, how doable these food eliminations are going to be, and we try to weigh the benefit versus the onerousness of doing it.
Yes.
The more strict you are and the more regimented you are, the better it works. But life is life, so we work with you to make it work for your life. So in that period of 2 to 6 months, you avoid the most reactive foods, and then we do some clearings of those foods, which Angela will talk about, which helps, and then we slowly start to add them back in. And so in my experience, there's likely going to be people that have a tendency towards food sensitivities, some sensitivities that are just going to be there forever, that you're not going to get rid of. But that's only usually a few. Most of them you'll be able to add back into your diet. The other thing I would say that we talk about with diet is the importance of food rotation. So this has also been around from the beginning of the theory and research of food sensitivities, that if you have a tendency towards this, the foods you eat every day over and over and over again are more likely to eventually cause a reaction as the leakiness of the gut ebbs and flows. And
right.
So one of the strategies for prevention is to rotate your diet, and also just a generally good idea for nutrition to get different sources of nutrients. But most of us here in this country eat the same thing over and over and over and over again. Every day, I'm even guilty of it, even multiple times a day. So most people have the same breakfast every morning, a sandwich or the same kind of salad every day for lunch, and then maybe a few different vegetables and proteins that are rotated at dinner. So that part's hard too, but we help you come up with a plan to try to at least get a 2-day rotation, if we can a 3, where you're giving your body a break, and that sort of helps the healing process. And then eating seasonally and locally and adjusting all those ways is helpful too.
So, and then if you really want to, especially, let's say like Chelsey said, oftentimes we do get patients, I've had them where they come back with not like a column of food sensitivities under severe, and then another half a column, and it's like, oh my God, what are they going to eat, right? So when we see that, what we've learned, and especially the more we see this, the more we know this to be true, is that really does not mean that your immune system is going to react like this to all these lists of foods indefinitely. What that is an obvious signal of is this leaky gut that we talked about earlier, or the intestinal permeability. So how do we really know about leaky gut? So what you would do is, if you want to take it a step further, you would do a stool test for gut microbiome evaluation. And in that stool test, we measure a certain protein called zonulin. And zonulin is that protein that can irritate the tight junctions of the intestinal lining and cause that intestinal permeability. So when that level comes back high, it's a clear indicator of leaky gut, along with all of the increased food sensitivities. So what we would do to treat that while you are, so it's like removing the foods that you're sensitive to is only one piece of the puzzle, right? That will allow for sure for inflammation to decrease. However, we really want to do some additional supplements that have been shown and proven to help repair that mucosal layer of the colon. So we want to do their like gut healing products, and a big one, we look at different formulations. But one key ingredient would be L-glutamine. So L-glutamine has been shown over and over again to really help heal the mucosal layer. So we want to supplement with some sort of gut healing product. We have our favorites, right? But some gut healing product that has L-glutamine. You'll also typically see products or supplements like like aloe vera and marshmallow extract, and also sometimes, very important, you'll see a mix of like quercetin and turmeric in those products. So we've talked about that on our other immune resilience talk, where quercetin and turmeric are very anti-inflammatory, and turmeric or curcuminoids have even been shown to decrease the circulating levels of IgE towards certain foods. Again, not anaphylactic reactions. We're not dealing with those, right? But we are dealing with how to heal the gut so that you can restore the integrity of the gut mucosal barrier. And then when we get to the retesting phase, right, we often see after someone's avoided these foods for a period of time, like Chelsey said, 2 to 6 months depending, and they've incorporated some gut healing products in the meantime, and they've really done a comprehensive approach, we'll retest and we'll find that sometimes we'll see a decrease in the total number of food sensitivities by up to 60 or 70%. So that's very encouraging, because when you get that first result back and you think, oh my gosh, I can never eat this again, that's not necessarily true. It means you've got some work to do on your gut, and then at that second test will tell us, okay, look, you're really safe to add sweet potato right back into your diet, but hey, egg or dairy or something like that, or soy, you may really need some more time, and it may be something that you're never able to eat on the regular again, but that you may be able to eat periodically without much complication, right?
And I'll say, before we had the GI map that gives us all this extra information about what's going on with the microbiome, we were doing the ALCAT at the beginning, and there were patients that wanted to avoid the allergens but didn't want to necessarily address the gut. When we would repeat it, we would find just a different set of allergens.
Right.
So they had gotten rid of their sensitivities to some by avoiding them, but then the leaky gut persists, whatever else is going on persists, so the immune system just targets whatever they're eating now.
Yes, so that's why it's important to do the additional step of healing the gut. I also forgot to mention immunoglobulin products containing immunoglobulins, like high quality. We use a liposomal colostrum here, but immunoglobulin therapy like that can be very found through products like colostrum, can be really also soothing and healing to the gut as well, and decrease the incidence of your food sensitivities.
Oh, one more thing, a question I get a lot is, when we do these tests, whichever test we choose, we have to be aware of the limitations. So I'll have a patient that does not show sensitive to dairy, and they get the results and they say, wait a minute, I get diarrhea every time I eat milk, or I don't feel well every time I eat eggs. But remember that we've got sensitivities to deal with, we've got food allergies to deal with, and we've got food intolerances. So we have to be aware of what we're testing for, and then we also have to always listen to the body. So if eggs always make you feel sick, like me, like they most of the time when I eat them I don't feel well, I've never shown sensitive to them. But obviously my body's giving me a message, and that's one of the ones that kind of happens right away. So you never disregard your symptoms or your body once you've addressed all the other things that it could be.
So we are short on time. We were going to try to end at 5, but we're going to try to sneak in a quick demo for anyone who is going to hang in there with us and sort of see it till the last minute, because it's one of the things that we do unique to our office. Is we use, if you guys were on the NET, if anyone watched our neuroemotional technique talk with Dr. Nielsen, we talked about muscle testing. So this is another way that we can assess a reactivity to a specific food. Now, we're going to show you a quick demo, and I'm going to tell you, when we do muscle testing for particular food sensitivities, right, the one thing that the muscle testing cannot tell us is it can't tell us why you're having that reaction. So this is going to just cast a wide net as to what is as to your reactivity level, but it's not going to tell us if it's an allergy, a sensitivity. It's not going to give us that information. We've even seen people have food sensitivity reactions with muscle testing due to emotional reasons. So maybe this was a food that your mom cooked in childhood that you hated, and she forced you to eat it, and you would feel sick about it, right? You can have that sort of reactivity to a certain food. I actually had a patient one time who had a high like sensitivity to beef, right, or reactivity with a muscle test to beef, okay? And it was like, but it didn't show up on any of her testing. It was like, what is this deal? Well, she ends up telling me the story that when she was young, she like had a cow, like lived on a farm or had a cow, right, and that she raised. And then one day, suddenly that showed up on her plate. And her dad or whatever was like, yeah, that's your cow, your pet. So she's too young to understand that this is like one of the best ways you could possibly get beef, right? Is to raise it yourself and take care of it and then eat it. But all she associated that with was like, that's my pet. And so, you know, she had this huge reaction to beef that was much more on an emotional level. So that's how we look at, we use muscle testing for food sensitivities. So we have, like, anyone who's been in our office has seen these plenty of times. So we have like kits that look like this, okay? I don't know if you guys can see that on live. And they contain, we have literally hundreds of these vials, testing vials. And they look like this, and they contain diluted amounts of original substances. So anyone that's familiar with homeopathy, they're sort of made according to that principle, where they are start with the original substance of the food and dilute it down, dilute it down, dilute it down, to where there's nothing really left on a molecular level except for sort of the energy transference or the energetic signature of that substance, in this case of food, in homeopathy it would be into the medicine. Here it's into the vials for testing purposes. So what we would do, for example, is Chelsey is going to give me her arm. Okay, so we would, as we talked about muscle testing earlier, like I said with Chris on our last talk, so the practitioner would have the patient's arm straight out in front of them and would just take 3 fingers and press down and give a test and ask the patient to hold that arm strong and or say resist. Okay, so there's going to be no reason why if I say go ahead and resist, she can't hold her arm strong. So then we make sure that we've established a strong muscle test, and then I would just pick a vial if I'm going through the list of things that we're going to test her for, and I'm going to give her this vial, and if I test again and her arm gives way, so go ahead and resist. Okay, so we're just showing you. Were you trying?
No, I was trying.
Okay, so she was trying. I was just trying to demo, but she's like, oh no, I'm trying to resist you. So if I try that one more time, resist. No, I can tell she's resisting. It's going weak. So that's actually almond.
That was on my Dunwoody.
That was on your Dunwoody. Shocking. This was not rehearsed, I promise you.
And I did not know what was in there.
She did not know what's in there. Lisa, actually, that was a little note. If any of you guys saw me like writing a note to Lisa halfway through, it was like, oops, we forgot to bring the vials. Could you possibly go get them? So Chelsey had no idea what I was just testing for because we didn't even have the vials when we started this talk.
And when I do this, I don't often tell my patients.
Yes.
Like a group of 10, and I don't tell them
We don't tell them because
that does affect like their ideas about what it is.
For sure, especially if there's an emotional reaction to it, right? We don't want to prime the patient to think about the food. We just want them to try to make their arm strong or not make their arms, or see what happens when they do try to make their arm strong, right? So as you just saw, Chelsey has a sensitivity to that. Now we have another set of vials that grades that food sensitivity on a scale of 0 to 10, okay? And so that will tell us whether it's mild, moderate, or high. And what we have found over and over and again is if somebody reacts at a level of 8, 9, 10, and I might even say 7, but for sure 8, 9, and 10, that is a food that they are going to be able to treat and get some span of time where if they do have, they choose to eat it, or they are at a restaurant or at a dinner party and it couldn't be helped, they had to eat it, they're going to be okay. But over time, that treatment's going to wear off and they're going to need to retreat. So how we treat it, let's say that really quickly, is what we do in clinic is so the patient would hold this vial while they receive a specific acupuncture treatment where we're choosing the points that help the body harmonize with that particular substance. So points that directly have an effect on the digestion, of course, the metabolism, the immune function, all of that. And so we give that acupuncture treatment, and what you would see at the end is they would hold this vial again in their hand, and instead of their arm going weak like it did prior to treatment, now the arm holds strong. Okay, and now also I want to add in there, if that reactivity level was like 7, 8, 9, or 10, it's definitely going to take 2 acupuncture treatments to get that down to a 0. Okay, now again, we want to put the caveat in, we do not do this for anaphylactic reactions. No, this is for food sensitivities, right? So why would somebody choose to treat them instead of just avoid them? Again, if it's something that they want to be able to eat occasionally, this helps. If it's something that they may find that they're going to get, like gluten, right? Parsley, right? Even those of us that are gluten free, when we go out to eat, it's very difficult to know for sure if there's cross contamination or, you know, that sort of thing. Or maybe I forgot to ask if the soup had flour in it, whatever, right? I mean, it happens. So testing and treating the food sensitivities with the acupuncture can at least give us sort of that, you know, it's like a safety net. It's a precaution just to help not react. And you would think, okay, does this really work, right? That's what I really want to know. Well, we have been doing this for almost as long as we've been in practice, and we have seen repeatedly over and over and over again it work. It also works with environmental allergens, dog hair, oak pollen, right? I have tons of patients that tell me every single season when we have oak pollen season from hell here in Vero that these are people with allergies or asthma, and they're able to make it through an oak pollen season without their inhalers, without increasing their medication, you know, anything like that, because the treatments do help decrease sensitivity to that food or environmental trigger. It decreases the reactivity so that you can, again, be exposed to it without the extreme of the reaction. Yep. Okay, so if anybody has any questions, we'll certainly stick around to take any questions. Stool testing, I'm not sure. So stool testing for food sensitivities?
It plays in because the results of your food sensitivities affect whether or not you will have allergies, so it's a piece of the puzzle for sure. And we've gotten so much good information from the stool that we often do that first, just to figure out what we're starting with, and if we see leaky gut or there's those symptoms that suggest it, then we definitely add the food allergy test as well. So they kind of go together. Right. But I don't know of any stool tests that specifically identify
food sensitivities. I'm not familiar with one either where you can identify food sensitivities through stool. The gut microbiome test is a stool test, and we are going to be talking about that not this Saturday, but the following Saturday. So I think that's May 16th. Yeah. So May 16th, we're going to do the gut microbiome talk and talk about the GI map testing and what that involves and all of the things that looks at, from zonulin to secretory IgA to bacteria, inflammatory markers, digestive markers, your good probiotic bacteria, dysbiotic, opportunistic bacteria, parasites, candida. We're going to talk about all of that, how to test it and what to do. So we're going to talk about the gut microbiome as a whole, not this Saturday, but next Saturday. This coming Saturday, Dr. Chris Nielsen and Amanda Millian will be here, and they're going to be talking about detoxing and Prolon, the fasting mimicking diet. If anyone has ever tried intermittent fasting but hasn't worked really well, we're going to talk about those different types of approaches to health, and specifically Prolon, the fasting mimicking diet, which we heard, Dr. Chris and I heard one of the researchers from University of Southern California, Davis, come to University of Miami's Integrated Medicine Conference in September and talk about it and their research. So it's a really well-researched fasting plan. So they're going to talk a lot more about that on Saturday. And I think that's it. If you guys don't have any questions or any more questions, we will see you back soon. Thanks for joining us.
Thank you.